Okay, we're here again today with Dr. Walter Bennett, and we're here to discuss some great stuff. This was kind of off the cuff, because he got a great article on golfing legend Jack Nicklaus, and I hope I don't say Jack Nicholson, which I usually do at some point here, but we can differentiate these two guys. Anyway, Jack Nicklaus. He came out now and he said that he had back pain his entire career. I believe his first episode was when he was 18 or 19 years old, and he played his whole career with varying degrees of back pain, sometimes severe. And Dr. Bennett's going to talk more about this, but he went to Germany and he got stem cell therapy, and supposedly, what he's saying is that the results are very, very good, and he's saying that he didn't hide that he went there to have it this night. He just never discussed it. You know what I mean? Because I think this is pretty cool because it seems like a lot of these celebrities and athletes and stuff, you pay them and they will say anything. You got these guys in McDonald's and Burger King and stuff, and they're really, that's not their everyday what they eat. They have nutritionists and this and that, but they're getting paid to say stuff. So you really have to watch stuff. And it seems like this is a story where he just did it and it worked, and he came out now and he said it. So it's really cool. So Dr. Bennett, what do you know about this whole story and about stem cell and back pain?
Yeah, you pretty much hit the nail on the head. I read the same story, and it seemed like he had his first cortisone injection at 19 years old, which is just crazy to me to have that kind of career with the pain he must have been going through to have cortisone injections at 19 years old. That's not very common. You don't see cortisone injections in teenagers. So
I was thinking that, can you imagine if what he would have been if he didn't have the back pain? Because he's a legend, and I can just imagine if he had this treatment 30, 40 years ago, but it just wasn't here, so it's incredible what he could have been. And it's incredible what a lot of people out there suffering with back pain, they don't know about this treatment. So that's why I want you to talk about talk about him and whatever you know about the situation, and then if stem cells can help back pain.
yes, yeah. From what I read in the article, he had facet syndrome, so his was a little different. He didn't have He didn't have the stem cells injected um, into the epidural space. He had it injected into the facets, which that's another way to do it.
Could you explain that? Because the average person, I don't think is gonna understand the difference between epidural space and the facets, and what causes pain and stuff like that. You know what I mean?
Yeah. Basically, the facets. Those are the articulating joints in actually everywhere in the spine, but in his case, it was in the low back. Um, if you get degeneration in there, it can cause rubbing and cause excruciating back pain. And from what the article was saying, this could have been the leading cause of his back pain.
It's
So he put the
incredible.
stem cells there, and it wasn't overnight, but from what I read, he really started feeling a lot of relief after a few months of it. So basically, the gist of the story here is the stem cells worked very well for his back pain. And like you said, imagine if he'd had that done 30 years ago. I mean, he could
Yeah,
have already a legend. He could have been like mythical in
yeah,
the golf.
and the thing here about the stem cells is, like you just said, it took a few months or whatever it was. People should understand how the stem cells work, and that they're not injecting something that's going to numb your pain. They're injecting something that's going to help to rebuild and heal you. Correct?
Correct. I'll kind of explain a little bit how it works. injured cells throughout the body, they'll give a chemical mediated response, which means they'll attract the stem cells to them. So you put the stem cells in, now they're attracted to this injured cell. The stem cells will actually hook onto that injured cell, and they'll pass nutrients, healing growth factors, that sort of thing, and they'll help these injured cells heal themselves. So it's really about healing. It's not going to be, hey, you put this in here and it's going to regenerate new cartilage. That's not how it works. Maybe in the past that's what was thought to happen, but that's really not what's happening. It's healing what you already have, but it's not going to make new cartilage or anything like that.
Yeah, I actually sent you a video of a doctor who was stating that about how you have to add something else with it that actually will regrow a cartilage, correct?
Right. They were talking about you have to actually add the chondrocytes, which are the cells that will make cartilage. You put those in, then the stem cells will help them produce it. But the stem cells aren't actually doing that. The stem cells aren't making new cells. They're just kind of healing what you got.
It's amazing, though, that nowadays, they actually used to think that stem cells produced the cartilage too. And as this stuff goes on and evolves, it's amazing that now that they know that, the cartilage isn't produced by them, but they know how to get that done too. It's just incredible.
Oh, it's amazing. When you go onto these research websites, there's literally hundreds of research studies currently going that are involving stem cells. So we're learning new stuff all the time. So, I mean, next month there'll be something new that, somebody's figured out. So it's a really exciting thing.
Yeah. The last time that we spoke, we really talked about how, right now stem cells, they're not this cure-all thing that some people think, and actually some doctors market them that way. But they are getting some incredible results in certain things, and it's pretty obvious that they are going to be the future, in that as the research comes out and as testing is done and as this stuff is figured out, I don't have much of a doubt that they're going to be able to heal, and we don't like to use the word cure, but have incredible results with almost anything, because it just makes sense. Correct? I mean, that seems to be where this is going to go, and quickly.
Yeah, I'm sure, and they're going to figure out what to add to the stem cells to heal almost anything, but we're not there yet. But I can see that's where we're going with it.
Yeah, I mean, just the fact that they've found how to harvest the stem cells from different places now. Everything is new, and the results are just gonna grow exponentially. And it's really cool to be on this cutting edge, like your practice. You're on a cutting edge of something that I personally believe it's revolutionary.
Yeah, I mean, we see a lot of different things, and does it help everybody? No. Like we talked about in our last webinar, sometimes the knee or whatever, sometimes the joint is just too far gone for it to get the results that you're looking for. But with most people, we're seeing literally life-changing stuff. I mean, people, they weren't able to play with their grandkids before, now they're able to play with their grandkids. They're able to go up and down stairs where they couldn't do that before. I mean, it's just life-changing stuff. It's just things that you take for granted, like going up the stairs to do your laundry, something you take for granted. But if you have severe knee pain, and people out there suffering with severe pain know exactly what I'm talking about. People take that for granted, but that's a big deal to be able to just climb stairs and go about your daily activities without pain.
Yeah, right before we went live here, I was talking to you, about my eyesight, and about a year and a half ago, I picked up my cell phone and I was like, "Whoa, am I going blind here?" Because I couldn't see it anymore, and and now I have to wear some glasses. And the big thing is, as you told me, I can get this fixed now. And not too long ago you couldn't. I've got friends that were almost blind as bats, and they can see unbelievably now, 20, like 15, and their whole life they were wearing thick glasses and stuff. So everyone knows that's the case, where you can just go get your eyes fixed, but not too long ago you couldn't. And I think the stem cells are going to be that for many things in the near future here. So could you tell us about the things you're treating there?
We're things that I treat in my clinic. We treat people with low back pain, neck pain, shoulder injuries, elbow, knees. We see people with fibromyalgia. We see people that they have gout, and the gout has kind of destroyed the joints, and now we're working on controlling the gout and trying to help with those joints that have been destroyed by the crystals from gout.
Yeah, and all of this stuff is done with stem cells, or you have a combination, right, of treatments?
Right, we have a combination. We do a lot of different things. Not all of it is stem cells. We do use stem cells. We use PRP. We use gel injections. Sometimes we use medications. There's just a lot of different things we do.
Yeah, it's cool.
Yeah, some of it involves strengthening the muscles around that area to give it more stability as well.
Yeah, you're not a stem cell doctor. You're a doctor who uses stem cells when it's appropriate.
Correct.
Yeah. What about the opioids? I read a study that came out recently, and I don't have it here. I'll see if I can find it and put it up on the screen here. That said that they're basically maybe as effective as over the counter stuff. If I'm remembering this right, I'm gonna put it up here so we can take a look at it. But anyway, there's a terrible epidemic, putting aside effectiveness, of people getting hooked on them, getting sick on them, destroying their lives with them. What do you have to say about opioids and what can be done so people don't have to go down that road?
Oh, I'll be honest. I did not read that study you're referring to, but yeah, if you can find it, we'll put it up. We'll put it up here and let people take a look at it. But I see opioids every day in my practice. I personally do not write them because I see the harmful effects from the opioids. Back in the 20s, you could buy like heroin over the counter. A lot of your cough syrups, your elixirs, your quote unquote potions to heal stuff. A lot of that stuff had heroin in it. And, over the 20s, we became a small nation of heroin addicts, and people became addicts not knowing it, and you saw it kind of in my impression. This is just kind of my opinion. I think part of that is possibly led to the Great Depression, because we became a nation of addicts, and so then that got controlled like in the 30s, and it became a Schedule I substance, which means you can't get a prescription for heroin. It doesn't have a therapeutic benefit. Then now you see what happens, but heroin is still an opioid. So now we're starting to see it again. The opioid epidemic has gotten out of control, and when patients can no longer get their opioids, they're turning back to heroin. So you're seeing a huge spike now in heroin addiction where you didn't see that, say, 20 years ago. So it's one of those things where, as a nation, we didn't learn from history, so we're repeating it again. So that's why I personally will not write those. I've gotten many, many people off of opioids. And like you said, you're seeing this stuff just ruin people's lives.
Yeah, the first thing a doctor, you learn is first do no harm, the Hippocratic Oath and stuff. And it seems that sometimes with, you go down these roads, and these opioids are extremely addictive, and they can be addictive on the first dose, So it's, if you have a choice not to take them, don't do it. I mean, my personal advice, especially when there's cutting edge treatments now, stem cell, PRP. There's just a bunch of stuff out there that you can try now. That's going to give you a chance that 10 years ago, 15 years ago, you didn't have that option. Correct?
Correct. And and with the opioids too, a lot when they first started being used for pain, a lot of these patients were good candidates for opioids. To be frank, a lot of them were terminal. So if they ended up with an opioid addiction, before the end of their life, it may have given them some relief. But then they got overprescribed for all kinds of things that I'm with you. I mean, I think if there's something else you could take instead of an opioid, that's the route you should go. I mean, opioids in the long run, opioids are no good.
Yeah, it's kind of a death sentence, get addicted to that stuff, and the rates of recovery of that kind of stuff are not good. It's not good, and your whole life can get wrecked fast. And it's really not your fault, but it is what it is at that point when you get addicted. So,
oh yeah, I just made a conscious choice in my practice. I'm not going to contribute to the opioid epidemic right now, and it's sad too. I mean, you see senior adults that are buying this stuff on the streets. I mean, buying opioids illegally. I mean, it's crazy.
Yeah, it's good people turned into a criminal because of a prescription.
Yeah,
and and I'm not against prescriptions and medications and stuff like that. But when you see the results and you see statistics, it's you really have to back off and say, hey man, I think we're doing the wrong thing here.
Yeah, it's extremely sad. It's just hard to see too. So
yeah,
there's a lot of other ways to control the pain other than opioids, and that's what I'm trying to bring to people. I'm trying to bring ways to control pain. Stem cells, PRP. We're doing a lot of different things in the clinic that can really help people, and without the need for opioids.
Yeah, cool. So today we touched on Jack Nicklaus, the cartilage stuff, the opioids. Anything else you would like to say about Jack Nicklaus and stem cells? And there's actually a lot of celebrities and athletes who have gone to Germany and stuff to get these kinds of treatments. The stem cell, the PRPs and stuff. And it was kind of like a silent secret for years, and people can Google this stuff and they can look up some names. Kobe Bryant, I believe, has done it. But
mistaken.
What was that?
I think he went to France, if I'm not mistaken, and had his done.
He went, yeah, I believe so, somewhere, and PRP, I think he had.
I believe so.
Yeah. So Google search, you can find it. You can find this stuff out, and usually when the top athletes have access to the best stuff there is, there's a lot of money invested, and they're going to get the best stuff, and they're going to get this stuff before the average Joe does. They're going to get some stuff that they have to go to Germany and France to get, because it's not quite approved here yet, and they're going to get some stuff, quite frankly, the average Joe just can't afford. So right. You have to take a look at this stuff and say, how are these guys getting back on the field and court? And you really want to take a look at that. It doesn't mean that you should have that treatment, but what it means is you should really take a look at it and look into it, because when there's millions invested in somebody, the teams and stuff, they're going to find an answer if it exists out there.
Yes. Yeah. The only thing I'd add is I do think Jack Nicholson was the best Joker.
I do too. How do you like that?
Yeah, we agree on it.
he might not have had stem cell. He might have. I'm not sure,
Who
but
knows?
maybe he had it, and that's why he was so good. A Joker. Who knows, right?
And
So
another one, I heard Mel Gibson's dad at 96 years old had stem cell injections.
yes, I read it. I heard about that. I think I heard a podcast. Um, and I think I heard Mel speak. That was for his hip pain, right?
I believe so.
Yeah, and the way Mel described it, it was pretty miraculous. It was like he couldn't walk and he could walk again. That's his testimonial. That's not ours. But you've seen some cases where people were in excruciating pain, and they've done very, very well with this stuff. So, hey, anything else?
No, nothing I can think of.
All right, cool. This is it for this week. Next week, we're supposed to talk about back pain, and we kind of talked about that today. So we're gonna talk about something great next week, and we're gonna flash up the number on the screen here for Dr. Walter Bennett. And if you guys would like to get a free consultation with him, he'll give that to you, right?
Yes, absolutely.
All right, cool. And with that, you can talk to him, and you can get your question answered about, you have knee pain, hip pain, shoulder pain, back pain, about the stem cells, all of this stuff, and he'll take a look at you and tell you a candidate for treatment or not. All right, so we'll see everybody next week.